Good afternoon. I'm Dr. Jazz Atwal. I'm Manitoba's Deputy Chief Provincial Public Health Officer. Today, there are no additional deaths due to COVID-19. The current 5-day COVID-19 test positivity rate is 11.8% provincially and 14.2% in Winnipeg. As of 9:30 a.m. today, 491 new cases of the virus have been identified, and the total number of lab-confirmed cases in Manitoba is 44,189. Due to health and safety measures required to keep families, individuals, and staff safe in response to COVID-19, Community Living Disability Services funded day services for adults with intellectual disabilities will be suspended for 2 weeks in Winnipeg. The closure will take effect on Monday, May 17, and extend until May 28. Some exceptions may be made where the safety of individuals cannot be managed in residential care or at home during the day. Manitoba Families continues to support the redeployment of day services and transportation staff to individuals' places of residence. Individuals being supported at home will be encouraged to use virtual meetings and other technology to stay connected with friends, families, and the broader community. I want to remind Manitobans that enforcement officials will be present at any rallies, large gatherings, and events this weekend. They will be closely monitoring events, including collecting video evidence in support of ticketing for non-compliance with the public health orders. Public health orders are in place to protect Manitobans from the spread of COVID-19, and there are consequences for non-compliance. I also wanted to comment on allergies and COVID-19 symptoms. Making the distinction between COVID-19 symptoms and allergies can be difficult. I want to encourage all Manitobans to err on the side of caution and take the online screening tool if you're showing typical allergy or cold symptoms. If this results in a recommendation to go for testing, please do so and self-isolate until you receive your results. We want you to be safe and keep those around you safe, and going for a test is the best option. Slide number 1. Today, I'm able to present the recent modeling information. This model was what we used to determine what additional public health measures were put in place to prevent overwhelming the healthcare system in the next several weeks. Current situation. Can you take the slide back one, please? Current situation. All key metrics indicate that case counts and severe outcomes in Manitoba will continue to grow substantially over the next couple of weeks. This includes increased case counts, a rising 5-day test positivity rate, increased hospital and ICU admissions, evidence of broad community spread, and increasing percentages of VOCs. In addition, an increasing percentage of hospital admissions are now younger adults as compared to Wave 2. Over the past few weeks, roughly 50% of our daily hospital admissions for COVID-19 are in those less than 50 years of age. And in this group, roughly 1/3 of people are less than 29, 1/3 are in their 30s, and 1/3 are in their 40s. It is anticipated that younger COVID-19 patients will have a longer length of stay in hospital than older patients, which could increase the risk of hospital resources becoming overwhelmed. Next slide. The model. There are a few points I'd like to make about the model itself. Manitoba uses an agent-based modeling strategy which simulates the life and decisions of 1.4 million people, representing all Manitobans. It tries to capture all aspects of social life and relationships, how each individual's behavior can influence the spread of the disease and the timing of different kinds of public health measures. Manitoba data from the beginning of the pandemic is used to predict different scenarios. The model has been updated to account for a higher prevalence of certain variants of concern and any associated increase in severe illness. Although the model estimates case numbers for the B117 variant, it still is a bit below what has been observed. This means the model may underestimate the impacts of the VOCs. New calibrations are on the way, and the model's immunization strategy has also been updated. Recent projections point in the direction that immunizations will be able to control the spread of COVID-19 in the longer term. Next slide. Projected number of diagnosed cases. As you can see, the daily number of diagnosed cases is now exceeding the upper end of the extreme scenario. You can see that the parallel red lines in November and in May are used to help visually compare the second and third waves. This means that we are on a similar path as we were during the second wave prior to the lockdown. This is most likely due to the highly transmissible variants of the virus. You can also note where we introduced new public health measures as cases began to rise in mid-April, and again at the end of April and in early May. Before the start of the third wave and early in the third wave, before any changes in the orders, we messaged on a regular basis to Manitobans on the need to adhere to the orders. This is because we need the public to change their behaviors and to limit interactions. We have always focused on having the least amount of restrictions on Manitobans. But as we saw case numbers rise, we had to do more. Prevent mortality and to prevent an overwhelming of the acute care system. And all along, we continue to stress the importance of adhering, as this is paramount in preventing the spread of COVID-19. The rise in cases we are seeing is related to not limiting contacts and not adhering to the public health orders that were in place. If we continue to follow the model, we could be seeing high case counts throughout the summer. And the current trends lead to the health system becoming closer to being overwhelmed. Next slide. Projected daily test positivity. Test positivity rates have been compatible with the extreme scenario and continue to increase. It's possible the test positivity rate could go above 15% in the extreme scenario. You can also note on this slide where we introduced new public health measures as cases began to rise in mid-April and again at the end of April and in early May. Next slide. Incident or new number of daily hospitalizations. Although the daily number of diagnosed cases has increased quickly, there is usually a lag between diagnosing a case and it showing up in a hospital. Hospitalized patients remain in hospital for a few days or up to several weeks, regardless if they are considered contagious or non-contagious. With the immunization of populations at higher risk of hospitalization, the ratio between the number of diagnosed cases and the number of hospitalizations is expected to improve. However, some variants of concern offer a higher risk of severe outcome. Different populations, younger and healthier or non-vaccinated people, are now requiring hospital care to a greater degree, which can still challenge the healthcare system's capacity. Again, I will reiterate, over the past few weeks, roughly 50% of our admissions to our hospitals in Manitoba for COVID-19 are in those younger than the age of 50. Roughly a third of these patients are under 30, with another third in their 30s and another third in their 40s. Being young does not make you immune to COVID-19. Being young does not mean you will not have a severe outcome. We have many hospital beds occupied by young people who are otherwise healthy. Please adhere to the orders. Please adhere to the messaging. Please book your appointment and get vaccinated. Next slide. Incident or new number of daily ICU admissions. The number of ICU admissions is aligned with the extreme scenario. However, we have already seen a spike in admissions that goes above the projected levels. Approximately 25% of patients remain in ICU longer than 2 weeks and can stay up to 7 weeks in our intensive care units. Therefore, ICU occupancy remains high despite weeks of lower test positive numbers and can peak around a month after lockdowns are implemented, as observed during the second wave. With the immunization of the populations at higher risk of severe outcomes, the ratio between the number of diagnosed cases and the number of ICU admissions is expected to improve. However, some variants of concern offer a higher risk of severe outcomes. Different populations, younger and healthier or non-vaccinated people, are now expected to require hospital care, which can still challenge the health system's capacity. Next slide. Is that slide number 8? Yeah, total ICU occupancy. The model estimates the impact of COVID-19 on ICU occupancy. The model tracks COVID-19 patients from their admission to ICU until they are discharged from ICU. Therefore, the model provides more accurate figures regarding ICU occupancy due to COVID-19 and should be compared to the data presented as red circles. The black circles show the number of contagious cases in ICU. However, some people end up staying in ICU beyond their contagious period. This is shown by the red circles. Right now, the projections show this number is now exceeding the upper end projected for the extreme scenario. It is important to note that a lockdown was implemented on November 12, 2020. The hospitalization data tells us the highest ICU occupancy level for all conditions was reached a bit over a month later on December 15, 2020. The hospitalization data also tells us the highest number of individuals in ICU due to COVID-19 was reached 3 weeks after the lockdown was put in place, on December 4th, 2020. This was expected due to the lag between diagnosing a case and someone requiring ICU care and long lengths of stay. The model was predicting our ICU capacity to reach the peak of wave 2 on May 23. The acute care system is prepared for this, and over the past several months it has increased net new staffing in the ICU, increased training opportunities for new staff for the ICU and medical beds, have put processes in place to manage COVID-19 throughout the province in acute care, managed beds to ensure capacity is available in the hospital, not only in the ICU, but for medical beds as well. The health sector has also implemented a number of other initiatives to prepare for high case counts. Last December, the virtual COVID outpatient program was introduced. This program supports remote home monitoring for patients discharged from hospital or those seen in an emergency department or referred to the program who do not need to be admitted. Without this program, we would currently require many additional medicine beds. The critical care nurse orientation program recently graduated new critical care nurses. Since April 2020, more than 100 nurses have graduated through the program and are working in the position they were hired into at the start of their training. Several nurses have completed the accelerated orientation, with more scheduled to begin the programming in the coming weeks. Further efforts to recruit interested nurses are underway. Additional nursing positions are being added to the system for nurses who wish to work in critical care. These positions will be at Brandon and at the Grace Hospital, Health Sciences Centre, and St. Boniface Hospitals. Work is also underway to add additional critical care beds at these sites. Changes are also being made to take pressures off the emergency departments. The system will be pushed, but they are prepared. They have noted that the restrictions are needed, and they are all asking all of us to reduce our close contacts and to adhere to the orders. Next slide. We're all tired of this pandemic. We're all tired of public health orders and hearing about the fundamentals. But these actions work and make a difference. We can bring our case numbers down and reduce the growing stress on our healthcare system. Last week, we put stronger public health orders into place, and while it usually takes 2 weeks to see a significant change, the orders have worked before. Going forward, we plan to release the modeling data more regularly. This will help people better understand our current situation and where it's heading. Right now, we need to bring our case numbers down and reduce the growing stress on our healthcare system. Stay home, reduce your number of contacts, follow the fundamentals and the public health orders. Make your vaccine appointment today. Together, we can make a difference. Now, before I turn things over to Dr. Reimer, I want to recognize that this week is National Nurses Week and that today is National Indigenous Nurses Day. Nurses are often the first face or voice you hear or meet when you make contact with the healthcare system. As a physician, I know I could not do what I do without their expertise, their knowledge, and their work ethic. I want to take this opportunity to thank all nurses for their dedication and hard work every day, but especially during these last 15 months of COVID-19. You have seen firsthand the devastation of the pandemic. Thank you for continuing to face these challenging times. I'll now pass it over to Dr. Reimer.
Thank you, Dr. Atwal. Good afternoon. I'm Dr. Joss Reimer, Medical Lead for the Vaccine Implementation Task Force. As you know, we've made some rapid changes in our vaccine eligibility. As of Wednesday, all Manitobans over the age of 18 became eligible for the vaccine. Now, Manitoba is becoming one of the first jurisdictions in the country to allow young people, aged 12 to 17, to book their Pfizer vaccine appointment. So beginning today, all young people aged 12 and up are eligible to book their first appointment. We believe this will help us protect even more people, more families, more communities from the third wave of COVID. We do understand that people will have some questions about the vaccine. That's completely normal and understandable. You might be worried that these vaccines were approved very quickly. But I want to assure the youth that may be listening, as well as their parents, that the vaccines have been reviewed very carefully. Health Canada has followed their normal processes to review all of the studies that the manufacturers have put forward, but have been able to do it faster than usual because of the additional resources and attention that are being put on this vaccine. The Pfizer COVID vaccine has been tested and reviewed and found to be safe for older children. You might also be wondering about side effects. Most people will have some minor side effects, such as a sore arm. Some people will have a headache, chills, or even a mild fever. This is all normal. You may also be wondering about the longer-term effects of the vaccine. We have decades of evidence from other vaccines demonstrating their safety in the short term and the long term. And so this vaccine, while new, is no different in how our immune system responds. The Pfizer vaccine is an mRNA vaccine, which means that it teaches our body how to produce a protein that triggers our immune response. So when a person receives the vaccine, their cells will read the messenger RNA, or the mRNA, like instructions, or like a recipe. After the process is done, the cell will then break down those instructions and get rid of them. So nothing about the RNA stays in our bodies permanently, and nothing about it changes our DNA. We have a lot of good information to answer your questions on our website. For the youth who might be listening right now, you can talk to a trusted adult, or talk to your healthcare provider, or look for reliable and trustworthy resources online. And if there's one message I can share both with the parents and the youth today, it's that when we are immunized, we will slow the spread of COVID-19. We protect ourselves, we protect the people around us, and we do this so that we can get back to the activities and the people that we love. So for more information, I ask you to visit protectmb.ca. All eligible young people aged 12 and older, or their parent, guardian, or caregiver, can book an appointment by calling 1-844-626-8222, or you can book online at protectmb.ca. And tens of thousands of you have already done that today. So I want to thank the many people who already heard about this eligibility and have called in or started the booking process online. When we're talking about the actual visit at the clinic, it is ideal if young people who are 12 to 15 can either attend the appointment with their parent, guardian, or caregiver, or have their parent sign the consent form ahead of time and bring that consent form along so that it makes the visit as easy and simple as possible. However, we know that some youth will come to the site both without a guardian and without a signed consent form. We do have a process on site where the youth will be sent to the informed consent and meet with a medical lead at that time. The medical lead will assess the young person's ability to consent on their own and make a decision about whether or not they have the understanding of the risks, the benefits, the alternatives, and then decide whether or not to proceed with the vaccine for that young person. This is consistent with how we do consent processes everywhere in the healthcare system, whether it's for a medication, a surgery, or any other treatment. The Pfizer vaccine is generally available at our super sites and the urban Indigenous clinics located throughout the province. I do want to note that our urban Indigenous clinics are designed to increase accessibility and provide culturally safe spaces for First Nations, both status and non-status, Métis and Inuit peoples. When non-Indigenous people make appointments or use the walk-in spaces at those sites, it limits access for First Nations, Métis and Inuit people. At this time, officials ask that only people who self-identify as First Nations, either status or non-status, Métis or Inuit, or people who share a household with someone who identifies as Indigenous, attend these clinics. Non-Indigenous people who do not share a household with people who self-identify as Indigenous are asked to make their appointment at super sites, at community pop-up clinics, and at medical clinics and pharmacies as applicable. We've also been hearing, particularly from folks in the healthcare sector, about some concerns about the level of protection that you get after one dose. So I want to reassure our teams that the studies are showing excellent protection from one dose. In fact, what we saw in the real-world studies, both in Canada, in the UK, and in Israel, was that about 80% of people experienced protection after just one dose. And this is excellent for real-world protection. We never in the real world get to the same numbers that we would see in a trial, for example. In addition, these studies have also shown that the one dose provides more than 90% protection against severe outcomes, like ending up in the hospital or even death. And so we do feel confident that this level of protection after dose one is a great way to protect yourself, even if you work in the healthcare system, combined with the procedures we have in place and the personal protective equipment that's made available. Now that all Manitobans over the age of 12 are eligible for a first dose, we will be able to start booking second dose appointments soon. And this is because we're now getting more supply. We're seeing increased shipments both of Pfizer and the Moderna vaccines. In fact, we're getting enough Moderna that we'll also be able to provide this at our super sites and clinics. And it also, with the changes with the shipping, the supplies that are coming in, we may be moving Moderna and Pfizer between our super sites. This is being done as those who are 12 to 17 are only eligible for the Pfizer vaccine. So it'll be important for us to be able to move Pfizer and Moderna around to meet the needs of those who don't have the option of choosing between the two vaccines. So it is possible when you attend a super site, you could be offered either mRNA vaccine. Moderna is an mRNA vaccine just like Pfizer. They work in the same way that I described earlier regarding sending that message to teach your cell how to temporarily produce a protein. They showed excellent results in the studies. They have the excellent safety profiles and are both providing great protection both in Canada and throughout the world. So I encourage you to make your appointment as soon as you can, and I know that many of you are doing that today, and you'll be given the vaccine available at the site on that day. So with that, we can now take questions.
Thank you, Dr. Reimer and Dr. Atwal. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Canadian Press, Steve.
Oh, hi there. I have a question regarding, I believe it's slide 8. I'm just wondering, these projections, and you say we're exceeding the worst projections in some categories, were these projections made before any of the recent restrictions were imposed, in a 3-phase part starting 3 weeks ago, And if so, what does that say that even after these restrictions have been imposed 3 times, tightened each time, we're exceeding the worst case scenario?
Yeah, just a great question there. So when we're looking at models, I mean, models are looked at on a regular basis all the time. When we have restrictions put in place, just because you have a restriction put in place doesn't mean people change behavior. You know, when you look at what's driving this extreme scenario is people's behaviors. So it's about those interactions. It's about not adhering to the orders to its fullest degree. It's about not listening to the messaging to its fullest degree. So you know, early on, we were always looking at modeling. As the numbers started increasing, you know, we messaged to Manitobans, you know, we need to worry about case numbers increasing. We need to worry about a third wave. We need to change our interactions with individuals. We need to adhere to the orders. And we implemented in an incremental way greater restrictions on Manitobans, but at each interval, even without those orders changing, we messaged to Manitobans on the importance of adhering. So now we've come to a higher point. You know, it's off the extreme curve there on slide 8 in relation to ICU admissions, which again isn't unexpected considering the case volumes that occurred. You know, we have put in greater restrictions as well right now. So we put in lots of restrictions on Manitobans, especially in Winnipeg and let's say in Brandon area with the closure of schools to, you know, reduce those transmission chains that are occurring in the community to limit that community spread. We should see a plateauing and a leveling off of these numbers. But that will only occur if people adhere to the orders and adhere to the messaging. So I think that's the important message here is we're asking people to do something. We've asked all along, and what we're seeing here is the non-compliance to that, which is driving this up. So as you can see, our system is being strained. We've put in greater measures, and now we're asking again. The acute care my physician colleagues in ICU and emergency rooms right across the province are asking, public health is asking for Manitobans to limit those interactions, to adhere to the orders. Don't do anything unless you have to do something.
And putting all these slides together, I'm wondering if you can boil it down and answer the following. I understand it might be a ballpark figure, not an exact number, but at what number is the intensive care unit usage expected to peak, and at what number is the daily case count expected to peak, and roughly when are those peaks expected to occur?
It's a tough question to answer. I mean, this is about people adhering. So if people follow the order, follow the spirit of the order, follow the messaging, you know, I think our case counts will likely increase over the next 1 week's time. We've already seen that increase since the orders have been in place. Hospitalizations and ICU capacity, I mean, there's a bit of a lag time there as well. So it would probably take 2 to 4 weeks before we start peaking in those areas as well. And it all depends on when Manitobans started to adhere to the orders. You know, did they start to adhere when our orders first changed on, you know, April 20th or 28th, or what percentage? Or is it going to be the May 7th order change where a greater percentage of Manitobans are adhering to the orders and the messaging? That plays a role in interactions and plays a role in risk on case generation, and again, hospitalizations and ICUs. You know, since April 23rd, our case numbers on a trailing 7-day average have increased 33% per week. Our hospitalizations have increased roughly 18% per week, and our ICU admissions have increased roughly, you know, about 20% per week. So I would anticipate, you know, in a week, if these percentages hold up and they peak, and we think that plateau is going to happen and Manitobans adhere, you know, and they limit those interactions, you know, probably we're going to see, you know, 18% more Manitobans in hospital next week and the following week thereafterwards before we get that peak, before that number starts to come down. So again, it is imperative, I think, that Manitobans really listen to the message, really try not to skirt around the orders, follow the spirit of the orders. And many Manitobans already do. We acknowledge that, but there are others who aren't. And I think we all know some people in our own lives that aren't, or if they have, they've just started to. Let's encourage our friends, let's encourage our neighbors, our community members to adhere to the orders and follow the spirit of the order and limit those interactions.
From CTV Winnipeg, Michelle.
Hi, Dr. Atwal. I'm wondering if you could talk a little bit about best case scenarios and where does the model take into account the impact of a larger portion of the province getting vaccinated?
So the model takes into account vaccinations and takes into account uptake of vaccinations and sort of immunity developing 2 weeks thereafterwards. There's roughly 250 variables in the model. The important thing here, again, this is all about behavior and behavior change. Best case scenario, people do what's asked of them. We're going to have a peak of cases in a week, a peak of hospitalizations, ICUs, in admissions in 2 weeks' time. Then we're going to see that drop off happen. That is the best case scenario, and that's what we're hoping for. This is what we want Manitobans to understand. The vaccinations, within 2 weeks' time, we're going to have another probably close to 200,000 people vaccinated. That's important, but just because you get the vaccine in your arm today, it doesn't mean you've developed immunity. It takes 14 days to develop immunity, and even at the 14-day mark, it's not 100% immunity. About 80%, depending on the vaccine, 85% will have immunity developed at that point, but there's still that other 15%. So again, best case scenario, adhere, limit those interactions. We're going to see some rises in case numbers on an average. We're going to see some rise in daily hospitalizations, total hospitalizations, daily ICUs, total in ICU for a couple weeks' time, and then we should see that taper down there afterwards.
Thank you. Dr. Reimer, with the youth announcement today for vaccinations, does this change at all plans for second doses? We've talked about previously that as soon as you drop to 12, the next day, second doses could be started to be booked, and that day is May 22nd. Are you still sticking with that?
So May 22nd was the date that our logistics team told us we would be able to open up to second dose, like no later than that date. And so now that we're able to reach youth sooner, I anticipate we could be opening up to second doses sooner than we originally projected. But I also have heard that there's been a lot of uptake today and a lot of appointments booked. So I think we're going to need to give a little bit of time since this cohort appears to be booking quite rapidly. We'll need to give them a little bit more time to book in before we're able to open up to second doses. But nothing so far has told us that we would be going later than the 22nd, and it will likely be earlier.
From City News, Stephanie.
Hi there, Stephanie Wilsuk from City News. Just wondering, as we look at some of these projections and thinking about schools, it was said earlier that we don't know after the current restrictions if students will get back into schools, but these numbers are pretty alarming for that June month. Is it safe to say that it might be a little bit implausible now that students would be going back to school? When you look at these graphs, what can you tell parents, I guess?
Yeah, we're working with education on a regular basis in relation to schools, and again, we didn't put schools on remote learning because we were worried about transmission at schools. It had to do with community transmission and what was happening outside of that school setting. So we're going to continue to look at our data. Obviously, a lot of our newer cases are in that younger population, and we're seeing a lot more of that shift between older individuals to younger individuals over the past few weeks who are getting infected as well. So I think it's too early to discuss that. I think from a public health perspective, we recognize and the importance of education, the importance of being in school, and we really strive, we really tried not to close schools in Winnipeg and Brandon. We knew it was very important for families, for students, for a number of reasons, and it was because we had so much community transmission, we had to go down that road. So the intent here is to try to get kids back in school, but it is hard to predict out, 2.5 weeks from now. So we're going to have to take this day by day, week by week, and look at that information that we have, and hopefully we see a reduction in community transmission, and then I think that will really allow us to bring students back.
Thank you for that. And then just looking at these graphs, some of these peaks coming in a bit later in the summer, what kind of hope can you provide to Manitobans that they might be able to see their loved ones this summer?
Again, this comes down to behaviors, right? So when we look at summer, the path that we're going down right now means a lot of cases are being generated. Summertime, we're still, technically about 6 weeks away or 7 weeks away from, the beginning of July. There's going to be vaccine available for basically anyone who wants vaccine. We're going to be into, the second dose for a lot of individuals as well. That's going to provide a lot of a relief from a case generation perspective, from a hospitalization perspective, from an ICU perspective. We need Manitobans. If we want a good summer, do we want to be able to get back to those things we love? Do we want to be able to gather with our families, have a barbecue, have people over, enjoy the outdoors? We need Manitobans to sign up for that vaccine. And we need them to sign up now. We need them to sign up for the second dose when it comes up. So really go out there. When again, it's everyone's opportunity now to get that vaccine, sign up for that vaccine. And that vaccine is what's going to allow us, a good uptake of vaccine, a high uptake of vaccine is going to allow Manitobans to get back to summer the way they remember summer being.
From the Winnipeg Free Press, Katie.
Good afternoon, Dr. Atwal. You've said that the virus is mainly spreading because people aren't following the orders. They're having household gatherings. But we have no information on the cause of exposure in almost half of all cases in Manitoba. Before we saw this modeling, the most recent provincial data that we had from earlier this month showed 23% of cases had unknown transmission, and 21% of cases were still pending contact tracing. So what is the risk of community transmission in the province right now?
Well, we're seeing lots of community transmission. We see a lot of transmission chains out there. When we talk to some cases, they are withholding some information. So we have lots of evidence of that. We have people who are being honest, who are saying, yes, I went to a bonfire. Yes, I had a sleepover. Yes, we, 6 of us got together at someone's house and played video games, right? Yes, we had a big barbecue. We have a lot of that information as well. So we know that community transmission is happening. This virus, it's about interactions. If you don't interact with anyone, you're not going to get the virus. Once you interact with one person, you have to look at all those other people that person interacted with to look at your risk as well, right? So the risk is there with interactions, and that's why we're asking Manitobans to limit those interactions. That's the most important way to plateau and to really bring down our case numbers, to plateau those cases, which will have a tremendous impact on our acute care system. And as more vaccine rolls out, it allows us to get back to potentially some of those things that we want to do sooner rather than later.
Okay, and related to Michelle's question, for Dr. Reimer, considering the current rates of vaccination, as well as the current rates of virus transmission, how long is it going to take to see the benefits of vaccine coverage in Manitoba, even with just one dose?
Well, we've already started to see benefits in some populations. So in northern Manitoba, we're seeing the effect of the third wave has been dramatically lower than the rest of the province. We've also seen huge differences in the risks in personal care homes. We were reporting many outbreaks going on at the same time and deaths every single day in personal care homes. And now it's a rare circumstance to have an outbreak in a personal care home. So we know that this vaccine, even with one dose, is already providing some relief in some places, and our numbers would be higher without it. What we anticipate is that when we're going to see the biggest impact on the overall wave is when we hit that 70% mark. But I do also expect that as we're getting above 50% of adults, which we'll be doing probably by tomorrow, that we're going to start to see some improvements. The model takes that into account. And so we're trying to balance what we know about the vaccines coming in with the delay in the immune system response, with the existing transmission patterns that we're seeing in the province.
From Global News, Marnie.
Hello, Dr. Reimer. Second doses, it sounds like they could be starting pretty soon. Is there a plan in place for where and how people can get proof of vaccination once they've received that second dose?
So you can already get proof of your vaccine on our online portal. So if you have a health card number, you can sign in and then you can see what vaccine you received and the date you received it. And so people can print that off as a record of their vaccine. For those who don't have internet access or don't have a health card, you can also call your local public health office and they can print off your vaccine results for you so that you have that as well.
And for Dr. Atwal, you mentioned younger patients. Obviously, we're seeing them in hospital for longer periods of time than older patients. Can you just provide reasoning behind that?
You know, we have variants of concern out there. They're more communicable. We've known from international studies, some of them, you know, increase your length and stay in hospitals or in ICU admissions as well. So again, you know, we have seen because of vaccinations, you know, the way we rolled out vaccinations, we protected those oldest first. And that's where we've seen that shift in hospitalizations over the past few weeks, where, you know, a month or two ago, the majority of our patients who got admitted to the hospital were over 50. You know, now we're seeing it less than 50. And a third of them are in their 20s, a third are in their 30s, and a third are in their 40s. The majority of the patients who have been admitted, even those in their 50s, 60s, and 70s, the last few weeks have been unvaccinated. There are some exceptions there, but for you know, the way the vaccine works, it's really effective, it seems, from other studies from outside of Canada. You know, even with our local learnings here in relation to vaccine, we're not seeing vaccinated individuals come into hospital. So younger individuals, there are some perfectly healthy younger individuals who had to be admitted. You know, we have a couple of younger individuals in ICU for sure, under 20. So it is a bit different of a virus and how it spreads, how it's communicable, but also its impact on one's respiratory and cardiovascular system, one's immune response to it, which is perpetuating some extra admissions. So, you know, we are seeing that shift. Again, some of these younger people have some underlying health conditions like diabetes or like high blood pressure. Again, some are perfectly healthy, and some are, you know, the biggest risk factor they had was like about 15 pounds of extra weight. So all those things play a role in risk. And we are seeing that dramatic shift now into younger populations being admitted. So roughly over 7 days, we had roughly 140 admissions to hospital for COVID-19. You know, 70 of those were 50 and under. So it's a big number. And just because you're young, you can't think that, you know, it's not going to impact you. It can impact you, and you can have a severe outcome.
From the Brandon Sun, Kim.
Good afternoon. We're hearing from at least one personal care home that there are at least 12 nurses who are refusing the vaccine. So what I'm asking is, what do you say to the families who are fully vaccinated, living in a bubble, but unable to see their loved ones due to the restrictions, where there are nurses on staff that are actually refusing to receive the vaccine?
Yeah, that's, I don't know about this particular scenario. I mean, what we've always done is encouraged individuals, talked about the risks and the benefits related to the vaccine. We put a lot in place to make it easy for individuals to get vaccine. There might be some vaccine hesitancy out there, and, you know, we've, on an ongoing basis, worked with those who are hesitant. And we're going to continue to do so as well. We're operationalizing a lot more on the vaccine side as well in relation to working with groups regarding vaccine hesitancy. Again, you know, it's good if you are hesitant to have that discussion with your primary care provider, have that discussion about with a public health individual as well in relation to your vaccine hesitancy. Get really good information on that to make really good decisions, not only to protect yourself, but to protect your family, your community as well.
Thank you for that. My second question is, you mentioned enforcement is increasing. I just want to touch base on that and just say, how is the collection of fines going? We're seeing the increase in the numbers of enforcement, but, you know, are we actually doing anything? Are we actually accomplishing collection of the fines?
You know, I'm not on the enforcement side, so I know enforcement is out there. I know they are ticketing. I know fines are being collected. I think, you know, asking that question to the justice side directly might provide you the best answer to that.
From CJOB, Skylar.
Thank you, Dr. Atwal and Dr. Reimer, for your time this afternoon. Dr. Atwal, you said that you and your colleagues have been looking at modeling for some time. We, at our outlet and other outlets across the province have been asking for that modeling for some time. You also asked Manitobans to adhere to the spirit of the order. And quite frankly, I find these models today quite depressing. I'm wondering, would there have been a greater adherence to orders if this modeling was released 2-3 weeks ago, instead of asking Manitobans to stick to the spirit of the order? You could have given them some concrete reason why they should.
Yeah, it's challenging. I mean, every time you develop a model, it might look a little different as well. We have looked at models. I think in the future we are going to be providing more modeling information that will be publicly available and presented to the public on a more regular basis as well. I think we've gone through experiences already with Wave 2, in relation to what to expect, what we're asking Manitobans to do. I mean, this is in all of our hands, right? It's up to us to change those behaviors. Perhaps for some, maybe if they saw a model earlier, it would change that behavior. Obviously we spoke to it, we stressed the importance of it. We had acute care colleagues talking and discussing and showing how busy the hospitals are as well. So it is challenging to say, maybe it would have helped in some situations, and in other situations it probably wouldn't have made a difference either. I mean, when someone is asking, when we have laws in place to say don't do X, Y, or Z, people need to adhere to that. And that really is impactful if they don't, and that's what we're seeing right now. So again, on an ongoing basis, we are looking at providing a model on a more regular basis, and we'll work with our group to provide that to the public.
Thank you for that answer. You talked about enforcement this weekend if there are in fact anti-mask or anti-lockdown rallies. I think a lot of Manitobans are trying to do the right thing and they are limiting their contacts, but it becomes very hard for them to adhere to those orders when very public instances of people flouting these orders are, present on the weekends or at any point. So is the province going to make sure that if these gatherings occur, the message is sent on the spot and not afterwards with retroactive fines, which have less effect when it comes to getting Manitobans to, adhere to the message?
Yeah, so my understanding is, and I know that enforcement has been much more visible over the past few weeks, they are ticketing a lot more as well. They will continue to do so at any gathering that's occurring. So different municipalities, the province, a lot of individuals will be out there looking for those who are breaking the rules, and enforcement will prevail at any one of those interactions as well. And I think any further details, again, I think would have to go to Justice to answer some of the specifics that you're asking about.
From the Winnipeg Sun, Scott.
Hi, good afternoon, both. Dr. Atwal, I mean, you're saying here that, essentially that messaging, people need to adhere to it, but it sounds that, it seems obvious that, there are some still not doing that, or maybe even more than some. And then you've also kind of alluded to the fact that modeling may have changed some behaviors, but not all of them. So what is the solution then to, you can increase messaging, but does the messaging have to change? What needs to change to get people on board?
So, we've changed the orders. We made it a lot more restrictive, made it really inconvenient for people to kind of get together. A lot of Manitobans are adhering, plain and simple. I acknowledge that. I think we all acknowledge that. There's some who just don't adhere at all. And there's others who are in general adhering, but they do at times, not adhere, make their own little risk assessment. Oh, I think it's going to be okay for me to go to my neighbor's house because our kids play at school together. That poses risk. For those who are partaking in those activities, and I think we've seen a shift in that as well, where now those individuals are becoming a lot more restricted and really adhering to those orders as well. So they're less hesitant not to. There's more buy-in there. So I think as our case numbers increase, as people saw that impact on the acute care system, as we continue to message out from a public health perspective on risk, I think it's clicking in a little bit and people are more adherent, and everyone does have a lax moment or they judge something to be low risk or it's right on the fence of an order, but they'll do it. And I think from the public's perspective, they just need to really limit all those interactions, right? Limit your interactions unless you absolutely have to. And we're working on messaging. We've always messaged through the pandemic. We always want the least amount of restrictions on Manitobans. If we want to lift restrictions sooner rather than later, we have to do something now. Everyone has to do something now. So really limit those interactions. Otherwise, there's a chance that, cases continue to rise. Acute care capacity continues to climb, and we're going to be in this for a lot longer. And you can look at our neighbors to the east, and they're running into trouble still, and they're going to continue to do so for a number of weeks, right? So do we want that to happen to Manitoba? Or do we want to just really, do what we can right now, really stop those interactions, really cut those transmission chains? If you're sick, go get tested, have your family self-isolate at home with you until you get that test result back. Fully participate with public health in those investigations. That's what we need Manitobans to do. Thanks for that.
On a different note, the CDC yesterday, I believe it was yesterday, made the announcement that people fully vaccinated would, cease to have to wearing masks in most public places. Is that something that Manitobans can look forward to once fully vaccinated, or is that something the province will be more hesitant on than our neighbors down south?
Yeah, so that, we're just opened up vaccinations for the first dose for those 12 and up in Manitoba. I mean, obviously getting that second dose is going to take some time. Will probably be sometime in July where most Manitobans will be able to get that second dose. Again, we don't want restrictions on Manitobans, barring vaccine escape, barring some other unintended issue, with enough Manitobans who are vaccinated, who have 2 doses of a vaccine. I think there's a lot that we're going to be able to do from a public health perspective. And not having a mask on would be one of those things. Obviously, we're not there right now. And what you're talking about is many weeks down the road, but that is very much on the table.
From CBC Radio Canada, Alexia.
Good afternoon to the both of you. Do any of you know how many vaccine appointments are booked in total as of today, and how many Manitobans are you projecting to vaccinate by June 9th?
So I don't have those numbers in front of me. We can take that back and ask our scheduling team if they have that available. But by June 9th, we should be able to have a first dose in the arm of all adults who want a first dose. With the week after that, we should be at everybody who's 12 and over getting a first dose. Now, of course, the way people book, it may not perfectly align with age cohorts getting their first dose in order. But those are the estimates that we have been working with based on what we're hearing from the federal government about how much supply we can expect to get.
Thank you for that. I was also wondering about your opinion on the overall ID of the post-lockdown Ottawa just released, which says, for example, that we could reopen terraces in the summer and reauthorize concerts the coming autumn. So what do the both of you think about the timeline they provided? Is it realistic?
Sorry, is that the timeline from who?
From Santé Canada.
So we are presently working on a strategy on how we would look at Manitoba's reopening. Again, we're looking at the information, and nothing is finalized at this point, so we are looking at something, and when something does become finalized, we will provide that to the public.
Our final reporter this afternoon from CBC Manitoba, Bart.
Hi, Dr. Atwal. Just going back to Steve's original question, on what date was your scenario range generated in this model?
I'd have to go back and get that information for you, Bart. I don't have the date.
But you don't want to make this a second question, but it was prior to mid-April, I'm assuming. Could you, to the best of your ability, given the trajectory that we see now exceeding our worst-case scenarios, based on everything you know right now, what do you think is the best and worst for case counts, hospital numbers, and ICU numbers at the peak of this in the next couple of weeks?
Yeah, so I think this was answered a little bit earlier, Bart. So again, if we get really good adherence to the orders right now, I think our case numbers will probably peak in a week or maybe just afterwards. Our hospitalizations and ICU numbers will still continue to climb, probably 2 weeks down the road, maybe even 3. This is all dependent on adherence and how people adhere and how they adhere not only to the orders but also about the messaging about getting tested, about self-isolating and waiting for that test result, about limiting those interactions and doing only what's absolutely necessary. So a best case scenario is, within a week we got a plateau. ICU numbers come down 2 to 3 weeks, peaking in 2 weeks with hospitalizations or 3 weeks and then trending down there afterwards. Now, obviously, if there is no adherence, we will go down not a very good path. But we are hoping and we are expecting Manitobans to adhere so that our numbers plateau and we limit the impacts on our acute care system.
Doctor, I asked numbers, not when. I asked the actual number.
The actual number. So, in the last, since April 23rd, I mentioned this earlier as well, sorry, the case numbers have increased by about 33% per week. The ICU numbers have increased by about 20% per week, and the hospitalization numbers have increased by about 18% per week. If we're thinking that the cases are going to peak probably next week, that might be another handful of percentage points going up. The hospitalization numbers I would anticipate going up probably by about 18 to 20% next week, as well as the ICU numbers, and probably a little bit higher there afterwards the week after before they start to trend down.
Thanks, everyone. This concludes our media briefing.